Good morning, Illini. We're glad you're with us this morning, and welcome back to Healthy Illini Podcast. I'm your host, Matt Schrock, and we are kicking off what I'm now calling the fifth season of our program. I realize that we are running into we started in August of 21, and so now we are in August of 25, so we're starting the fifth season. But we're glad you're with us. If you've been here from the beginning, thank you so much. If you're new to the program, welcome, and check out our archive. You'll see lots of great discussions and materials there. But today we want to kick off the fifth season talking about the coming fall semester and McKinley Health Center. I'm joined once again by Awais Vaid. He's the executive director here at McKinley, going on your fourth year, I believe. So Awais, thanks for being back with us.
Thank you, Matt, for having me.
You've been on the program before. We do this about the start of every semester, fall semester, to talk about things. And again, we're excited to have students back on campus, and we're already seeing some get here. We've had a few events where we're seeing that they're trying to learn as much as they can. They're trying to figure out what's on campus, what their resources are, and we're blessed because we have a huge campus with lots of resources. But, one thing that we've both seen and the leadership has seen here at McKinley is when you go other places and talk to other campuses and talk to other healthcare workers and administrators and things, that oftentimes they're a little bit shocked by what we have. They're a little bit surprised by what we offer for the size we are, for how our structure is. And for our students, sometimes they're blessed to have all these resources, and they don't always know how good they have it until they're gone. We hear people who leave are like, man, I wish I could go back to whatever it would be, whether it's McKinley or the ARC or anything on campus. And so I really wanted to start this one as we're talking about the fall semester and what's coming, and give you a chance to kind of brag on McKinley and what we do. So from your perspective, what are some of the things that McKinley does well on this campus and the campus does well in healthcare? What are some areas that, really kind of stand out that students may not, or listeners may not be as aware, that it's kind of unique to what we do here?
Sure. Thank you for that question. So once again, like you said, students are coming back soon. Summer was a good time to decompress. It was quiet. It was wonderful. But you know what? It was lacking the energy on campus.
Yeah.
So I'm glad students are back next week, and hopefully, the energy comes back with them. So what is great about McKinley? I think there's a lot to brag about, and I don't think 10 or 15 minutes is going to be enough to talk about all the good things that we do at McKinley. But to start off, as you all know, that we have been around for 100 years. So we have a long history of doing this on campus, and we have always been student-centric, student-focused. So that has been our focus for so many years. And we've learned from previous mistakes. We've learned from experiences in the past, and we try to improve every single year. One other thing that we do well at McKinley is that we listen to students. It's not about what we want, it's about what students want. So we have, over the years changed based on what the needs and the wants of the students are. You may or may not know that we are one of the largest independent health centers on campus. We see approximately 90,000 student visits every single year. We have a large staff. Among health centers who are independent, we probably have one of the largest staff to student ratio. So that's wonderful as well. We have an independent building, which many of our peers in other Big Ten campuses do not. And we have an all-encompassing service model as well. So it's not just that you are seeing a primary care provider and then you're going out for your labs, you're going out somewhere being referred for x-rays, and then you're going somewhere else for your medications. You're getting all of that on campus in a location which is very accessible. You can walk, you can bike, you can take the bus. All of that is accessible. We are open 6 days a week. During the semester, we are open Monday to Saturday, 6 days a week. Most health centers are not open 6 days a week. They're only open 5 days. We also have a 24/7 nurse line, where if you have a question after hours on the weekends, you can call. You can get advice. We don't want students who are unsure about their healthcare sitting in the emergency room at midnight and then being dispensed Tylenol to go back home after 4, 5, 6 hours of waiting, and then also get a bill of $300.
Right.
You don't want all of that. So I think, in short, we are the official campus health center. We are here for the students. That's all we do. And we have a lot of resources available in one building where we are not just providing healthcare for students, but we are also providing education and outreach for students across campus throughout the year.
Before we move on to the next thing I wanted to ask, I do want to make one clarification. When you say we're independent, what does that mean for somebody listening? They may not understand.
So when I say independent, many large campuses, Big Ten campuses, have an academic health center on their campus, and student health center is typically part of that. So they are not necessarily independently functioning as a student health center. They are part of an academic health academic hospital, or an academic health center. And UIC is a very good example of that. They're not really independent health center. They're part of a big hospital system. We have always been independent by ourselves. We are not part of any academic institution or hospital.
And that's one of the things I want to clarify, because the scope of what we do is really fairly unique for being in that position. Most places that have, the breadth of what we provide often have that academic side or have other units they can kind of tie into and collaborate with. Whereas what we do is in this building, and that's really a unique position to be in. So with that, one of the things that we were promoting this fall semester going forward is we're kicking off a new campaign. And that new campaign is simply Your Healthcare Starts with McKinley. And a lot of that comes from because we have so much in this building that we offer that is a part of what we do and what students already have access to. So if you would take a few minutes and just kind of share, what does that mean, Your Healthcare Starts with McKinley, especially for students who really don't even know what healthcare really means yet?
Right. So this campaign was, it took a long time to come to fruition to what it really is. Start your healthcare with McKinley. And it was very intentional. The reason for that is, before students come on campus, most of our students, 17, 18-year-olds, have never taken care of their healthcare by themselves. It's typically their parents who've, assisted them, taken care of them, made appointments for them. And as you know, healthcare system in the United States is and can be very complicated. We are the official healthcare center on campus. We are accessible for all. We are open every single day, 6 days a week. So when we say start your healthcare with McKinley, it's all encompassing. If you have a question about your healthcare, if you have concerns about your healthcare, if you're not feeling well, if you want a physical, if you want some labs done, even if you have something complicated, except in an emergency where you want to call 911 and go straight to the emergency room. But if you have something complicated, you want to start everything right here. As you know, every single student who's registered for classes here on campus for 6 or more credit hours is paying a health service fee. And your health service fee covers all your services at McKinley Health Center as many times as you want throughout the semester. Whether you have opted out of insurance or not, your access to McKinley is still valid. You are able to come to McKinley all the time. You are not paying $30 or $40 copay to be seen by a provider. You are not paying copays to get your labs or x-rays done. You may pay a very small $5 copay for prescriptions, but that's about it. So you are really saving a lot of money by coming to McKinley rather than going to a community clinic or a hospital where you would be paying for every single visit every time you go. And from our experience, what we have seen is more than 90% of all the things that students typically deal with can be taken care of right in-house at their visit. You can be seen by the provider. They will prescribe labs or x-rays or EKGs for you. You can just go downstairs, get that done at the same time. They may be prescribing medication for you. You can pick it up right then and there at the same time. So it is saving you a lot of time and effort. And not to mention this, but again, as I said earlier, we've been doing this for so long. We know how to take care of students, and we do it really well. That's what we do. We only take care of students. So our providers out here are really well tuned to what's happening in the community. If there is, an outbreak or a trend of mono going around, or if another infectious disease is going on, or an STI is going around, they are very well aware of what's happening. So coming here is much better for you than going to a community provider who may not be knowing exactly what's really happening on campus.
Well, and that's part of the what our goal is to understand campus, but also educate campus. So if there is something happening on campus, we know it, we can give advice or give direction that will help protect that student, which helps protect other students. Which it's that if you're educating new consumers, then they become better consumers, and the process works better. The whole system works better. We can serve students better. They can serve themselves, that kind of thing. And so that really is a key to start here, because there's so much information and knowledge and education experience that our providers can give and our staff can give that'll just help students be better in the long run.
Absolutely. I mean, for us, providing care here does not mean just prescribing and you go home and then you're done. That's what you get when you go to a community provider. Out here, education is a key component of what we do. Health literacy is a key component of what we do overall. Not just the provider you are seeing, but at every level that you see. You know, our nurses, our technicians, our educators, they're all working with the philosophy of educating students to be better consumers of healthcare. Not only when you are here on campus, but also when you graduate from here and you're out there in the real world, to be able to understand, signs and symptoms of what is an emergency, when you should seek medical care, when you can just go and pick up, a Tylenol or ibuprofen or a cough syrup, and when you really need to call 911. Those are the things that we want to educate you about, as well as a lot of preventive measures as well, right? We have a lot of health educators in the building who are constantly going out in the field talking about stress management and sexual health and nutrition and exercise. So we are not just a health center trying to take care of you when you're sick, but our overall philosophy is to keep you healthy. And if you are healthy, then you will excel in your academics, then you will excel in your life as well.
And you mentioned health ed because that's education there, but we also have mental health, we have women's health, and that's part of that education piece too, because we don't do specialties, but we have a few particular focuses that helps with that, because we saw the need to have that specialized kind of education information availability on that as well. Excuse me. And but you talked about just going to the ER and sitting getting Tylenol. We have vending machines. It's that whole aspect of trying to hit every part of what a student might confront, because we know students, because we know campus, we know how it goes, we see trends, things like that, and that's really where our philosophy comes from on a lot of that. So with that, if you're starting your healthcare at McKinley, and if you have questions about that, we have the information in our bio how to contact us. We're on our website. You can find us all over the place on campus with information as far as how to get a hold of us. So if you have questions, please reach out on that. You said it. We have 100 years of experience, and so we have a lot of knowledge. But we don't just sit on that. We don't just sit back and say, okay, we got to figure it out now. We're good. We're just going to chill. I know, especially in the last few years under your leadership, we've really been pushing to see where can we improve, where can we get a little bit more, where can we be more efficient, that kind of thing. So what are some of the things that students should know that are that are working behind the scenes, or things that are possibly coming, or just what are some of the things that are exciting you this fall about what McKinley is doing and where we're headed?
Sure. So let me just emphasize that in healthcare you never want to become complacent in how you operate, because if you're complacent, if you get bogged down by the way you are doing things, then you will be very much behind everybody else. Things are moving really fast with the age of AI and all the technology advances that we are seeing. We want to make sure that we are adopting all of those things. Absolutely, we want to make sure it is in the best interest of students. We also want to make sure that it is what students want, and also we want to make sure that it is it's the best technology that we are adopting as well. So a lot of exciting things on the horizon. One thing that is exciting me a lot is that we are in the process of establishing an urgent care center in the heart of campus in the Illini Union. It's going to be in the lower level. It's going to be urgent care. It's going to be acute care. And that was one of the things that students wanted. Students wanted something quick in and out, easily accessible between classes. If they have something simple, they can just it's as good as going to an urgent care, convenient care, where you are typically just making an appointment, getting in and out in 15 minutes, and you're pretty much done. That's something that we have been working on diligently for the last 1 year. I'm expecting by the end of next year, it will be almost ready to launch. So that is very exciting for me. One other project that is exciting for me is the referendum that the students asked for to add optometry services to our list of services that we offer at McKinley. As you know, optometry appointments are very hard to get for students. You may have to wait weeks, maybe months. You may have to travel, miles. Sometimes you may have to go home sometimes if you're not able to get an appointment out here. That's something that we care about a lot. I know students really want that. So my hope is that in the next few months, we get a green light from the Board of Trustees to move ahead with that. We have already done the pre-planning for it, and we are ready to implement as soon as we get the approval from the Board of Trustees. So there are quite a few things that excite me. One thing that we have been working on diligently in the summer is upgrading our legacy electronic medical record system. So we were on a legacy system which was in-house, locally housed, outdated for the last 10-15 years. As I said, we don't want to become complacent. We want to move ahead with technology. So we have upgraded our electronic medical record system to a cloud-based system, which will have the potential to integrate with a lot of AI tools that we are seeing coming out. We have already implemented that. The first few months, just let me be cautious, are going to be a little bit difficult. There's always bumps when you start something brand new for the providers and for the staff here. But that's going to be overall beneficial for everybody in the future. So lots and lots of new things. You just touched on the vending machines. We are looking at expanding those vending machines in the future as well.
And the crowd went wild.
And the crowd went wild.
Because we get asked that all the time. Can you put a building in my building? Can you put more on campus? And so that's something that students want to hear, and it's great that we're moving that way.
Absolutely. So we have one already. As you know, we have 4 across campus. We are going with a different company. So we are trying out one more. My hope is that in the next month and a half, the 5th one will be here in our building. We'll try it out for a semester. If it works well, then we'll expand that to multiple other locations across campus. Again, we want to provide the best possible care. We want to listen to the students, what they ask for, what they say, and we want to implement, based on what is going to be the best for the future of the students as well.
I love the vending machines we have, but one of the things I love is that when we started looking at it, there wasn't anybody who was doing it for us. We kind of had to figure it out because it wasn't happening hardly anywhere. And so, like you said, looking for a new company, we talked to a company. They're like, "Well, we don't really do that." Well, can you? Well, we'll try and figure it out. And that points back to the progressive identity and the determination to move forward that McKinley has. That we're going to try and if we have to, we'll break ground somewhere. If we have to, we'll be the front runners on it because we see the need, we see the opportunity, we see where it is. And so that's kind of the philosophy you go back to, not sitting on our laurels and pushing forward. We saw it with the vending machines. We're seeing it with other places, other things too. And that's something that students, again, may not be aware of. They just know that we have a great health center. So it's really nice to be able to highlight that a little bit on that.
And just a reminder, every single student, whether you are insured by campus or you have waived your insurance, you have access to McKinley. And not just McKinley, but access to all the services, including vending machines. You can go to any vending machine, swipe your card, and pick the items that you want. Again, let me specify this again. Even if you have opted out of health insurance, you have access to that because you have paid the health service fee.
And, to be fair, that's confusing for people and parents too, because nobody had, like, we don't have that. You and I don't have anything like that where we just go and use a service. We, insurance and all these things. That's what parents are used to. That's what they kind of teach their students about. But it's different here. That you've already paid for it through tuition. You can come to McKinley. You can use the vending machines, and it's that uniqueness of what we do and that students have that is really it's good to highlight because it's important for them to understand. But before we go, I do want to have you mention one other thing that we have on campus, and this is kind of partly for listeners to have so they have the resource of it, but also kind of shout out who they are. We have a student advisory board that we use here, and you're involved in that. You lead that. We have students who are co-leads on that as well. But would you talk about kind of what that is and why that's so important to McKinley?
Right. So, again, when I first started talking about McKinley, I did mention that, we are here for the students, and we always want to listen to them to make the best decisions about the direction of McKinley moving forward. Not just moving forward, but also to always analyze and assess what we are doing, if we are doing it well, or if there are if there is scope of improvement in what we are doing. That's one of the reasons why we have a student advisory board. It is a group of students who are currently on campus. They are undergraduates, there are graduate students, and there is some faculty and staff involvement as well. And we meet with them throughout the semester every single month. And the whole idea of meeting with them is to get input from them, to improve ourselves, but also to talk to them about the future of McKinley, to talk to them about what are the services that they would like us to start looking into, to start exploring as well. A very good example is, the vending machines now have Plan B. This was one of the ideas or one of the discussions that happened in the student advisory board meeting. Optometry services came up as one of the ideas in the student advisory board meeting as well. Our addition of clinical massage therapy that we have currently was an idea that was run by the student advisory board, and they loved that idea. We have one clinical massage therapist, and I can tell you they are booked. They are booked solid throughout the year. I can add 4 more and they'll still be booked. So having that team is excellent for the student because they are getting experience. They are getting real world experience of working with a health center, being on the advisory board, so that it counts as experience when they are going in the real world and looking for jobs and going in and being in healthcare. But it also is beneficial for all students because they are not just 8 or 10 students, they are representing every single person across campus.
Well, like you said, we could a 15-20 minute podcast. It's hard to get everything captured in that, but I think you did a great job. But thank you so much for joining us again today. Thank you for coming, and again, thank you for your leadership with McKinley as we serve the student body here on campus. And I just really appreciate you taking the time out today to talk to us.
Thank you for having me again.
If you're listening to this, and especially if you're a student on campus and you have questions, please reach out to us here at McKinley. Reach out through our website, through our email. You can call. We want to hear from you. We want to answer your questions. We want to educate. But also the Student Advisory Board, part of the reason we mentioned that is because they are the representatives of students in a lot of ways. And so if you want to know who's on the board, how to contact them, you can go through our website. You can email us. We'll put you in contact. Because sometimes it's easier for students to talk to students than it is to talk to somebody else. And so we want you to reach out. We want to answer the questions. We want to educate. We are here to serve students. We are here to serve you on campus and to guide you in your journey and to walk alongside with you. So if you have any questions, please feel free to reach out. Be sure to follow us on social media. We have an Instagram, we have a Facebook. Follow those. We have a YouTube. Maybe you're listening to this on YouTube, but follow us there and engage with us because there's a lot of information, a lot of events, and it's just a really good way to support you and another resource for you to have when you're here on campus. But thank you for joining us today. You are on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.